And what you found is that he has limitation going to the right. Say he hurts or he gets pain and limitation when he turns to the right. You are going to mobilize into a right rotation. So wherever he has the limitation is the area you're going to attack first. Okay? And again, don't get caught up on this, but if he has rotation issues but his pain is on the left, my hand placement will be on the left. That's where I'm going to start. It doesn't mean that I never go to the right, but I'm going to go where he gets the pain, but he turns his head into the side of limitation. All right? So you're all a little confused. So remember this. You always want him to turn into the direction of limitation. That's where you're going to start. If he gets pain to the right side with that, I start to the right side. If he gets pain to the left side when he turns, I place my hand on the left. Okay? Basically, the theory on this is that there is a positional fault here. So if you're C4 moving on C5 and you turn to the right, what does C4 do on C5? It goes down, right? So if I'm C4 and his head is C5, when I turn to the right, we should all start to go down to the right, correct? Mm-hmm. What Brian is saying is that there's some positional fault there, and that he's already, C4 is stuck down on C5. So when he goes to rotate to the right, there's no room for that to go, so he's having pain. There's no sliding or gliding availability on C4 to C5. So what he's going to do is he's going to say, all right, on my mobilization, I'm going to bring him back where he belongs, all right? So now C4 and C5 are resting correctly, and as he rotates, I'm going to allow it to come down, all right? But I'm going to facilitate it out. I'm going to correct it first and then allow it to come down. So when you do these corrections, when these mobilizations, and I'm going to show you, when you mobilize in that superior diagonal direction, I'm correcting the positional fault, but when he turns, I have to go with him. Otherwise, what do? Now you're going to jam him up. So you have to correct and then rotate. You see that? Okay. So, I don't know if you guys can see, but you're going to may have to move a little bit. If he's, again, rotated to the right, I'm going to use the distal part of that medial pad of my thumb, all right? I'm going to go out to what Brian calls the articular pillar, near the in between the transverse process and the spinous process. That's my contact. So if we're going to the right, my contact thumb is my right. Because when I mobilize my left thumb here, I want to push up and out. If I reverse that, what's going to happen? I'm going to compress the segment, all right? You'll make this mistake once, and then you're going to figure it out because you can visually see it. So middle part of my thumb here, thumb pad like this. My contact and mobilizing thumb is my inferior thumb. I'm going to push up and out, all right? So if he's compressed down this way, I'm going to push him up where he belongs at that oblique angle. Then I'm going to hold that as he starts to rotate. I go with him. You'll see my hands move. I rotate with him. This is where he's going to do end range overpressure. So as we are going, and he should have immediate results, all right? He starts to turn. Once he gets kind of where he's got soft tissue limitations, he needs to do overpressure into that direction. Now this is important because you get lasting effects, but also you got to look at his positioning. A lot of times people do this, which is side bending, or they go into a quadrant. You have to have that pure rotation, all right? So let him go to the side of his head. Don't go to the jaw. You know, sometimes there's TMJ problems there, or you don't get a good rotation. Up to the side of the head, and pure rotation, no side bending. If they were having problems going into a quadrant, then that's what you want to work. But right now we're doing pure rotation, okay? So I'm going to place my thumb here. I do my glide here, and it's an upward direction. So these two fingers are not choking him, but I do get a little bit of counter pressure here. You should not be doing this, all right? So it's here, and it's here. He should feel an upward direction. So you get through the soft tissue, do the mobilization up. I maintain this. Go ahead and turn to the right. He goes to the right. I go with him. He uses his right hand for overpressure. Right hand for overpressure. He just did everything your patients are going to do. All right, here, and then you're going to do overpressure. All right, let me go back, though. All right, so we go here. I'm going to go up a little bit higher so you can see a little bit better. Apply the glide here. Go ahead and put your hand on your side of your head. Go ahead and turn and do overpressure. Good. And then back off a little bit and do 10 extension. Go ahead and look up, and I drop down. Do I need to do overpressure?
Yeah.
No, you got the weight of the head. So you don't want to compress that. All right? So it's here, lift up, go ahead into extension, and I drop down. Now you're going to say, you know, at the end I feel like I'm losing it. I feel like I've lost contact. That's because you have normal range. Think of somebody who doesn't. It's usually right in here that you're starting to hit a problem. All right? He's got full range. At the end, of course, I'm going to pop off.
And I just want you to, I want to have you show the extension again, but notice how her forearms maintain the treatment plane. So her forearms stay in the treatment plane as he's going into extension.
Yeah, you got to extend your, it's all legs. All these are usually legs. So I apply the glide here, I stay, he goes down, I go down.